This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Well, going to the dentist is a routine for a lot of people, but there are some people that just simply cannot go at all.
Yeah, that's because they're overcome by fear. But as Brian Spiros tells us, there are ways to calm those nerves. And if you're embarrassed by your fear, don't be, because as you'll soon find out, you're not alone.
Are you afraid to go to the dentist? If so, you're not alone. 75% of adults in the U.S. have some degree of fear when it comes to getting dental work.
It's the most common phobia. It's higher than fear of heights and fear of spiders.
The most common one is the needle. I hate needles. And also bad experiences. They'll say, boy, I had a tooth removed before, I wasn't numb enough, and the doctor wouldn't stop.
Dr. Joe Harmon and Dr. Raymond Mikowski are dentists with Delmarva Dental Services in Salisbury. They say people have so many thoughts racing through their mind at the very thought of going to the dentist, which prompts the fear. They think about the cost, sounds, there's even the fear of the unknown. Dr. Harmon says people are also afraid because of what they hear from others or the way dentists are portrayed in the movies. The fear can even stem from a personal experience.
They've experienced a time when they had a filling or an extraction and they felt pain and the dentist didn't stop or never got them numb enough. And they usually never forget that. In the back of their mind, they could be numb 10 times for 10 different procedures. If that happened one time in their life, in the back of their mind, they're waiting to feel that pain.
This doesn't mean you have to avoid the dentist altogether. Delmarva Dental Services has various methods that help put the patient at ease. First, they have you fill out this questionnaire. It gives them an idea of how nervous you are based on a number range. The severity of your fear will determine the best way to calm you. It can be as simple as putting on headphones to drown out sounds. But if that doesn't work, there are other measures they can take.
We have laughing gas or nitrous oxide, which doesn't put you to sleep, it just relaxes you, and you breathe nitrous oxide through a mask. It's very, very safe, and once you take it off, you get back to normal in about a minute, so there's no lingering effects. The next step is we'll use a short-acting sleeping pill, and they'll take a sleeping pill and they'll use the laughing gas, and then the step after that is we'll do IV sedation.
Dr. Mikowski is certified and trained in IV sedation.
Once you give the IV sedation, it works in a matter of minutes, as opposed to if you take an oral pill, it may take an hour or so for it to kick in. And if someone's sitting in a waiting room, waiting for a pill to kick in for an hour, that just can increase their anxiety. So the IV sedation is perfect for that type of person.
Dr. Mikowski says the patient is first prepped. Vital signs are taken, anesthetics are applied, and a vein light is used to find the perfect vein to administer the IV. This helps to calm those who also have a fear of needles.
Then we very slowly put a little bit of midazolam, which is the relaxing agent, and we just put a little bit at a time till you can see them just kind of melt in the chair, you get a little smile on their face and feel totally relaxed. If someone is having a big surgical procedure, we'll also add a narcotic to it to also help deaden any sort of pain, helps with the post-op pain also. And once they're in happy land, then we anesthetize them and get to work.
As of right now, the sedation is only used on adults, but children also fear going to the dentist. Dr. Harmon has some advice when it comes to your kids.
Many times the parent inadvertently will convey their fear to the child. If the child's coming expecting nothing, but they're saying, they're saying things like, well, it's only going to hurt a little bit, and the kid's not even thinking about what's going to hurt. You put the word hurt, or it's only going to sting, those kind of things. And even looking at the parent, a child can look at the parent's face, and if the parent's afraid, many times they'll look at the parent and they'll be afraid. So parents mean well, but sometimes they can scare a child.
Finally, if your fear is causing you to put off dental work, Dr. Mikowski says you may want to consider the sedation route. The longer you wait, the worse it can be.
They start putting it off and it just snowballs the problems. They may have just needed a cleaning. Now they're scared. Now they hold it off. Now they need a couple of fillings. they're scared they don't come back and have the fillings done. Now they need root canals and crowns. So all the expense just snowballs out of control.
And doctors Harmon and Mikowski say that after sedation, there are patients who gradually lose their fear of going to the dentist. Then there are those who still need to be sedated every time. And also for certain types of sedation at Delmarva Dental Services, it's required that someone is there to help you and drive you home after your dental work. And you know, I'm one of those people. I have anxiety when it comes to going to the dentist, and it's not so much pain or anything. It's just this, I do not like metal on teeth. Like the sound and all of that. I just don't like it.
I think in the same vein I was going with the sound thing. I can distinctly remember sitting in the dentist's office listening to him drill on somebody else.
Yeah.
And I don't know why that affected me.
Yeah.
But yeah. So
well, now it doesn't have to affect you anymore.
Get past it. You're okay. Well, still to come on Delmarva Life, do you have that one room in your home that's either too hot or too cold? No matter what you do, just can't seem to get the temperature right?
Well, we're going to show you a different way to heat and cool your home. It'll not only keep the family comfortable, but it will show off your creative side as well.
A little bit later on, it's one of the most famous races on Delmarva, and it's set to take place Labor Day weekend, the National Hard Crab Derby. What it takes to get a crab to cross that finish line. Plus, Ryan's going to show us what the race looked like when it first started 66 years ago.